Now, I know different women have different breast sizes and their pain tolerance may be a little bit different, but if we think about a few minutes of getting this mammogram done and a few minutes of discomfort related to a significant diagnosis of breast cancer, then come on, ladies, let's get the mammogram done. Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey friend, welcome back to today's episode. Today we are talking about something that I believe is so important every day, many times in a day in my clinic. I address this with women who come in, and that is the discussion on mammograms. Now, don't get all in a wad when I say mammograms. It's something that we all need, we've all got to do, but it's also something that there are just a lot of misconceptions about. So I want to spend today kind of debunking some of the myths that are out there about mammograms. And so that's what we're going to talk about today. But before I get into that even, I want to talk just a little bit about breast cancer. Did you know that outside of skin cancers, breast cancer is the most common cancer in women in the United States? According to the American Cancer Society, about 1 in 8 women will develop invasive breast cancer in their lifetime. My goal is for that number to absolutely decrease, and my goal certainly is for that one person to not be you. So I don't want you to go around believing any of these myths that are out there about mammograms. I want us to talk about them today and make a plan moving forward, because we know that early detection of breast cancer through mammograms is one of the best things you can do to reduce the risk of dying from breast cancer. When you get those mammograms and you're able to find something early, then you have so many more treatment options that are available to you. And that's why mammograms are important. The 5-year survival rate for breast cancer when it's found early is very high. And so the same way I stress to women in my clinic all the time, I'm going to stress to you, my listeners, and that is to be diligent about getting your mammograms. So let's spend today kind of debunking some of the common myths that are out there about mammograms. And the first one is the one that I hear so often. You already know what it is. It is everyone's biggest complaint or concern or issue of why they haven't gotten their mammograms, and that is, Dr. Anderson, mammograms are just too painful. Let me tell you this. I got my first mammogram probably about 3 months before recording this, and I'm here to tell you that excuse no longer flies in my office. Was it uncomfortable? Yes, a little bit. Was it painful and the worst thing that I did that week or even that day? Absolutely not. That discomfort is brief. I would almost rather get another mammogram than to get my eyebrows waxed. Literally, getting my eyebrows waxed is more uncomfortable to me than getting a mammogram. Now, I know different women have different breast sizes and their pain tolerance may be a little bit different, but if we think about a few minutes of getting this mammogram done and a few minutes of discomfort related to a significant diagnosis of breast cancer, then come on, ladies, let's get the mammogram done. It's not that bad. Literally, I have a sign in my office that says, just get it done. It's not that bad. And yes, it's uncomfortable, but it's not that bad. So again, that excuse no longer flies in my office. Now, there are some things that you can do with scheduling to maybe minimize your discomfort. And one of those is not getting the mammogram around the time of your menstrual period. So there are some ladies that just during their menstrual period, they have more tenderness of their breasts. And so they may find it even more uncomfortable if they're getting their mammogram mammogram while their period is on. And so if you are able to kind of finagle when you get it scheduled, maybe think about not getting it scheduled around the time of your period, but please don't cancel your appointment because your period's on, only if it is just super convenient for you not to do it around the time of your period. And what I tell folks is, after you get it done, if you need something to reward yourself for doing it, go get a milkshake or go find yourself some kind of treat afterwards. Give yourself a pat on the back, whatever you need to do. But please don't let the thought that the mammograms are too painful be what keeps you from getting it done. Like I said, I got my first one recently, and for so long as a physician, I've heard patients say, gosh, Dr. Anderson, those things are painful, and gosh, those hurt. And I literally want to call every one of them back who said that and say, come on, friend. Yes, it was uncomfortable, but was it truly the worst thing I've done in a long time or the worst thing you've done in a long time? Because most times that answer is no. And even if that answer is yes, again, I stress it's just for a short time. So that's myth number one, that mammograms are too painful. Here's myth number two, and this is a big one, and that's people thinking that they can wait until they're age 50 to start getting their mammograms. So I know there are several different guidelines that are out there, but if we look at the guidelines from the American College of Gynecologists, or ACOG, or the American College of Radiologists, or the Society of Breast Imaging, that recommendation is that women should have started at age 40 getting mammograms done. Now hold on a minute, because I'm going to tell you a little bit of caveat here too. There's some women, especially if they've had a family history of having breast cancer, who should not wait until they are 40 to get their mammogram. And if you'll let me throw another wrench in here, there is a new trend towards women getting their first mammogram. Now, this is what we call a baseline mammogram when they are 35 years old. So not even waiting till 40, but getting that first one at 35. Now, the reason for getting that one at 35 is to give the radiologist kind of a reference when you're young, otherwise healthy, what your breasts are like. You don't start your yearly screening at 35. For most people, you get that one done, and then your regular yearly screening picks back up when you hit 40. Most insurances are on board with that and will cover you getting one mammogram between 35 and 40, and then starting your regular yearly screening at age 40. Whether you decide to get that baseline mammogram between 35 and 39 is completely up to you, but let me just tell you, when you hit 40, you need to be ready to start getting those mammograms and to get them done every year. So there should be no thought to waiting until you get to age 50 to start getting your mammograms done. We certainly need to start before then. So myth number 3 is I don't have a family history of breast cancer, so my risk isn't that high. Now, it is absolutely true that having a family history of breast cancer puts you at higher risk, but the opposite of that is not true. It is not true to say that having no family history of breast cancer means that you are not at risk. Remember when I told you earlier that 1 in 8 women will have an invasive breast cancer in their lifetime? All of those women, I guarantee you, did not have a family history. It is possible, and often happens, that women are diagnosed with breast cancer and they have absolutely no family history. So I'm asking you not to let not having a family history of breast cancer be the thing that keeps you from getting your mammogram done. Myth number 4. If I don't hear back from my results, that means everything is fine. I don't let that fly in my office with anything. I tell my patients, even if we're, drawing blood work or checking a urine on you, you ought to hear back from us with results. And you should hear back from us within a reasonable amount of time. The same thing is true for mammograms. In most places, when you get your mammogram done, it's read either that same day or the next day, or certainly within 2 or 3 days afterwards. It should never be the case that weeks or months go by and you've not heard the result of your mammogram. Usually, the facility that does the mammogram will either call you or send a letter to you. I actually think that it's mandatory that they have to follow up with you and let you know the results. But at a minimum, your doctor or whoever ordered the mammogram should have received the results and should be able to tell you too. So I'm asking you, if you have a mammogram done or if you've had one done months ago and no one called you back, I don't want you to just assume, oh, that must mean everything is normal. I want you to hear someone say, or I want you to see in writing that your mammogram was normal. You could take care of this on the front end by when you're getting the mammogram, before you leave, ask the person, it can be the tech or it can be the person who's at registration, how am I supposed to get my results? And they'll either say, oh, we'll call you with results, or we'll send you a letter, or your doctor's office will tell you. But that gives you a way to know who you should expect those results to come from. I want to emphasize that it is really crucial to follow up and to make sure that you receive those results. So if you don't hear anything else I say about mammograms today, and I hope that's not the case, I hope you hear everything, but one of the big things that I want you to take away is making sure that someone tells you the result of the mammogram and you're not just assuming that it's fine because you didn't hear anything back. Myth number 5 that I hear all the time is that it'll take too long to get it done. And that, I know now after getting my first one, is not the case. The process is so quick. So there is a place that is near where I currently live where I got my mammogram done, and they had me completely in and out in 20 minutes. 20 minutes from the time I walked in the door until the time I left. Now, they were not busy on that day and they have walk-in spots. And so I walked in, got the mammogram done, and was out. But even from the time where they called me back or the time that my breast was actually at the machine, it was minimal. It may have taken 5-6 minutes for her to do the entire test. I spent more time sitting in the waiting room, which was still a relatively short time, than I spent waiting for her to get it done. In and out in 20 minutes is wild. So think about 20 minutes in and out, maybe it's 30 minutes, the 5 minutes it takes you to get it scheduled, the 5 minutes it takes you to receive the results, that's 30 to 40 minutes. 30 to 40 minutes to save your life is absolutely worth it, in my opinion. Even if it took them an hour of you sitting in the waiting room and took them 10 minutes to get it done, 2 hours of getting that mammogram done is well worth it to save your life, in my opinion. So please don't let it'll take too long to get it done be what keeps you from doing it. You've got sick leave at work, take that sick leave. Get them to write you an excuse if you need one for work, and make sure you are taking care of yourself. I promise you that job will still be there when you get back. Another myth, and this one maybe isn't so much a myth, but sometimes a habit that we get into, is saying, I'll remember when to schedule it next year. That almost never happens. I can't tell you how often I see women in clinic and I'm going back through their results, and maybe I haven't seen them in a while in clinic, and we look back to see when their last mammogram was, and I'll say, hey, when was your last mammogram? And they're like, oh, I got it done a couple months ago. I can't remember when my next one is due. And I look back and it wasn't a couple months ago. It was 19 months ago that they got the mammogram done, and it's time to get the next one. And the reason that happens, that we lose track of it, is because life happens, right? And how often do you tell yourself, oh, I'll remember to do this later, and we just forget? The same thing happens with mammograms. So some of the things you can do as far as kind of making a strategy to remember is putting a reminder in your phone. Actually, whatever you're doing right now, as long as you're not driving, I want you to stop. I want you to figure out the last time you got a mammogram done. Go back, whether it's through your phone, if you've got something at home, if you've got an email that tells you when it was done. I want you to put that day in your phone, and I want you to go ahead and set a reminder every year for that same date to get a mammogram done. And not just that, but I want you to go back 1 month before whatever that date is. So say your date was March 5th, that on March 5th, you got a mammogram done. March 5th, every year from now on, needs to say, get a mammogram. And February 5th needs to say, make sure my mammogram is scheduled. That way, you've got a reminder in your phone that says it there. Another thing you can do is before you leave that appointment, go ahead and schedule your next mammogram. So before you ever even walk out of the radiology center, or when your doctor calls you to give you the result of your mammogram, go ahead and put in the order for the one next year. That way you won't forget. Here's another myth, and this one is a big one, and one that I, as a physician, actually believed for a long time, and that is not true. And it is that I always need a referral from my doctor to get a mammogram. Remember earlier when I said that the place that I went to was a radiology center, and I was really surprised to learn that you don't even have to have an appointment. But not only do you not have to have an appointment, you don't even have to have an order from your doctor. Now, when I talked to the lady at the registration desk about this, I was like, hey, I'm a physician. Are you saying that I don't have to send in orders for my patients for them to get this done? And she says, well, usually no. They can call, schedule it themselves, and then we'll send you the order afterwards. And it made so much sense because that happens so often through the day that I'm signing an order, and I guess I just don't realize that, hey, I wasn't the one who put this order in, but absolutely Miss Jones needs her mammogram, so I'll sign this. But there are some radiology clinics, usually it's standalone clinics, maybe one's not associated with the hospital, but you can call and schedule that appointment yourself, or they'll have walk-in times. Like the one I went to, you can walk in, maybe it was between 1 o'clock and 4 o'clock, and just get your mammogram done. Now, I'm sure it's easier for them if you have an order from your doctor, but it's not required. And so if you live in a town, or if you've got towns around you that have standalone radiology or imaging centers, you may think about calling them and saying, hey, do I have to have my doctor's order to get the mammogram scheduled, or can I just go ahead and schedule it on my own? And you may be surprised, but even if they do say you need to have an order from your doctor, guys, I promise you, it does not take that much from me as a doctor to schedule your mammogram. I'll say even that it takes nothing from me as your doctor. There are so many times that I know my nurses get people's mammograms scheduled and I don't even know about it. It's one of those things in our office, we call it a standing order, meaning if you can look it up and know that a patient is due for their mammogram, there is no need for you to be chasing me down saying, hey, Dr. Anderson, can you give me a verbal order for this patient to get their mammogram done? We just know it needs to be done. So if the place that you want to get your imaging done, the place that's convenient for you, says that you do need a doctor's order, please call your doctor's office and say, hey, I called so-and-so place. They said that I need an order for my mammogram. Would you mind putting that order in for me so I can get it scheduled? The other thing you should think about is that you don't have to be at your regular annual exam for your doctor to order your mammogram. You can be there because you stubbed your toe, because you got a rash, because you've got a headache. If you know you're due for your mammogram, there's no problem with just saying while you're there, hey, I'm due for my mammogram. Would you mind going ahead and sending that order in for me? I personally think that is perfectly reasonable. And I love when my patients come up with it on their own without me having to look back at the end of the appointment and saying, hey, when are you due for your mammogram again? But think about how much more efficient you can be in your doctor's appointment and how much better you can be in control of your health in general if you keep track of those dates. And if you're able to say, hey, Dr. Anderson, my last mammogram was on February 17th of last year. It's January 14th. Would you mind going ahead and putting that order in so I can go ahead and get it scheduled? As your doctor, I can promise you that would make me really happy. So we've gone over some of the common myths or some of the things that you may hear women saying that keeps them from getting mammograms, that they're too painful, that they feel like they should wait until they're 50 to start, that they don't have a big family history, that it'll take a long time to get it done, that they'll somehow magically remember 365 days from then to get it scheduled, that if they don't hear their results back, it's okay, everything's probably fine, or that they have to have an order from their doctor or have to schedule an appointment with their doctor to get the order done. Those are things that I want you to leave at yesterday. If you have other questions about your breast health in general, if you feel like you've got new nodules or lumps at your breast, this is something that you need to be talking with your physician about. Go ahead, schedule an appointment, get in the office with them, let them get a good exam done, and determine whether or not you need to get an ultrasound of your breast, or if you need to get a mammogram done, or if you need them both done. Earlier, I gave you an assignment, we'll call it your homework for the week, and that is to find the date of your last mammogram and to go ahead and lock it in your calendar every year from now on until you're at least 75. Lock it in that is the date or around the date that you need a mammogram. and go ahead and lock in whatever date is 1 month before then and make that 1 month before then your reminder to ensure that you have that mammogram scheduled. That's your homework. Once you've done it, come over and find us in the Facebook community. I'm going to put the link to the Facebook community in the show notes and say, I did what I was supposed to do. My girls are covered. I look forward to seeing it there. I hope you have a great rest of your day, a great week, and I'll be right back here next week with another episode. We'll talk then. Bye. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.